I'm Dr. Jordan Allison. I'm a psychologist and behavioral health consultant, and this is what I was meant to do. So the warning signs of depression can look a little different for everyone, actually. There are certainly some common symptoms though that are important to be aware of. First of all, we want to be looking at the obvious one, which is feeling depressed, feeling down, sad, hopeless, helpless, worthless, things like that. Secondly then, we're looking at what's called anhedonia. Anhedonia is a clinical term for a loss of interest or pleasure in things that you used to really enjoy. There are also physical symptoms of depression. There are things like impacts on sleep, impacts on diet, and then on energy as well. When it comes to sleep, some people will sleep much more than normal and others much less than normal. Likewise with appetite, it can swing extreme in one direction or the other. So perhaps you begin to overeat or to remarkably undereat. And then it will certainly impact your overall level of energy, your motivation, and your drive. And then some other symptoms involve the way that we begin to think. And so first off, there can be shifts in cognitive energy or speed. You might struggle with things like memory, with learning new things, or even remembering where you put things around your house. Also some decreased concentration and struggling with focusing while you're at work, while you're trying to read, or maybe even while you're just watching TV. And then lastly, and certainly most concerning, is the reality that with depression can also come thoughts of harming yourself or even ending your life. And so we would definitely want to be aware of any of those thoughts or feelings that people may begin to experience. So there's no one-size-fits-all cure for depression. That being said though, there are a number of treatments that have been shown to be remarkably effective for a number of people. From the medical interventions on the medication side, to the psychological, the therapy and the counseling, then the behavioral and the environmental shifts and changes. We definitely know though that when combined, they're the most effective. So one of the things that I hear most often from both my friends, my family, and the patients with whom I work when it comes to depression is I should be able to handle it on my own. And what I will always say to them is that seeking support or professional help for your depression, it isn't acknowledging that you can't handle life on your own. It's realizing you no longer have to handle life on your own. The best first step is going to be to talk to your primary care provider and discuss with them what options may be available to help you.